Hello everyone. The topic for today is cellular adaptations. Our body is made up of multiple cells. So we have a normal cell. Any injury to the cell, it can be physiological or pathological. This injury is known as stress. Physiological injury. What is example of physiological injury? Physiological injury is not basically injury. Neither it is injury nor it is normal. It is like hypertrophy of muscles in case of pregnancy, in case of any liver transplant. Example. These are examples of physiological injury. So, there is any stress factor, that is any injury to the normal cell. The first step is the cell undergo stress. It undergo adaptations. This is the first step. This is reversible. If the stress is removed, it becomes a normal cell again. This is known as cellular adaptations. If the stress continues, it will convert into reversible cell injury. This is moderate stress. This is also reversible. If the stress is removed, it can become a normal cell. If the stress still continues, it becomes a severe irreversible condition, irreversible cell injury, and this irreversible cell injury is known as cell death. It can occur by two forms, either necrosis or apoptosis. This is not reversible. It can never become a normal cell again. So, adaptations, what are adaptations? These are reversible changes in size, number, metabolic activity, or any function in response to change in their environment. This is stress, any injury, anything. So, we have a normal cell. There are 5 multiple adaptations which can occur. First is atrophy, hyperplasia, hypertrophy, metaplasia, dysplasia. And as the name suggests, hyper. Hyper means zyada. A means less. Plasia means number. And trophy means size. So with the name atrophy, decrease, trophy means size, decrease in size. Hyperplasia, hyper means zyada, plasia means number, increase in number. Hypertrophy, hyper means zyada, trophy means size, increase in size. These 3 are done. Next is metaplasia. Metaplasia is change or replacement of mature cell to another mature cell. And dysplasia is disordered development. So, the first topic, it is atrophy. A means less, trophy means size. So, reduction of size of parenchymal cells of an organ or its parts which once was normal is known as atrophy. It can be of further 2 types. This is a normal cell. This is a atrophic cell. Loss of organelles. It is of 2 types, physiological and pathological. So, physiological examples, it is because of aging, atrophy of brain with aging, or atrophy of gonads after menopause. Pathological can be starvation atrophy, ischemic atrophy, disuse atrophy, neuropathic, endocrine atrophy, brown atrophy, hormonal atrophy. Starvation atrophy, it is because of starvation, depletion of fats and carbohydrate stores which is followed by protein metabolism. Then we have ischemic atrophy. It is seen in Reynolds phenomena or Berger's disease. Disuse atrophy. In case of fractured arm, it is atrophy of the muscle. Then we have neuropathic. Neuropathic atrophy is seen as poliomyelitis. Then we have, this is an important one, brown atrophy. Brown atrophy is atrophy of heart in old age. And a pigment is formed known as lipofuscin. This is a brown color pigment, therefore the name is brown atrophy. Hormonal atrophy. Hormonal atrophy is seen in cases when there is loss of hormone supply, for example, post-menopause. Second is hypertrophy. Hyper means zyada, trophy means size. So hypertrophy is increase in the size of parenchymal cells resulting in enlargement of an organ or tissue without any change in number of cells. It can also be of 2 types further, physiological and pathological. Physiological, we have examples, enlarged size of uterus in pregnancy. And whereas pathological cases, in case of pathology of smooth muscles, in case of pyloric stenosis, or in case of cardiac muscles, in case of systemic hypertension. See, this is a normal cell, hypertrophy. Hyper means zyada and trophy means size. The size of the cells are increased. Next, we have hyperplasia. Hyper means zyada. Plasia means number. Increase in the number of parenchymal cells resulting in enlargement of organ or tissue. See, difference in hypertrophy and hyperplasia. This is increase in size and this is increase in number, hyperplasia. It is of two types, physiological and pathological. Physiological is further of two types, hormonal or compensatory. Hormonal may we have example of smooth muscles of uterus or breast in case of lactation, pregnancy or puberty, and compensatory in case of liver transplant patients. The new liver, there is liver hyperplasia. Next is metaplasia. Metaplasia is replacement or change of mature cell to from one mature cell to another. It is C. It is a reversible change of one type of epithelial or mesenchymal adult cell to another. We have two types of cells, squamous cells and columnar cells. So if squamous changes to columnar or columnar changes to squamous cell, this is known as metaplasia. This is an example. See, this is columnar pseudostratified ciliated columnar epithelium which is converted into squamous. Squamous metaplasia. This is known as squamous metaplasia. This is the most common type of metaplasia. And the site is respiratory tract. This is bronchus. This is the normal lining. It is converted into squamous epithelium. This is the most common site and this is the most common type. Lastly, we have dysplasia. Dysplasia is alteration in size, disordered development in size, shape and architecture orientation. See, these are normal cells. This is dysplastic cells. Size is different, orientation, nucleus size, nucleolus, cytoplasm, everything is different. There are histomorphological alteration, enlarged nucleus and cells, prominent nucleoli, NC ratio is high, NC ratio is nuclear to cytoplasmic ratio, hyperchromatic nuclei, pleomorphic nuclei in cells, this mitotic activity is increased, dyskeratosis. These are all examples of dysplasia. See, dysplasia is further of three types, mild, moderate, severe. This is a normal. Mild change is mild dysplasia, moderate is moderate dysplasia, and extreme is known as severe dysplasia. This was all for today. These are all 5 types of adaptations which are covered in cellular adaptations. Thank you, everyone.